My name is Peyman Kabolizadeh. I'm the director of the Beaumont Proton Therapy Center. We are the only proton therapy center in Michigan and one of the few in the country with the highest technology of pencil beam proton therapy center. Proton therapy is pretty much a very accurate and precise radiation treatment using particles, proton particles. It is a very targeted therapy. Sometimes the tumor is located near very, very critical organs, right, like optic chiasm or neurovascular bundles, and that is hard to deliver radiation without damaging those structures. So proton therapy enable us to deliver this high dose radiation to that area without significantly damaging those structures around it. In normal radiation or a standard photon or X-ray radiation, there is an entrance dose, that's how the radiation gets in, and there is an exit dose. So the structures around the tumor, around the target is going to get some radiation because they have to exit. But in proton therapy, there is no exit dose. The proton goes in, drops the energy, kills the tumor, stops there. There's no exit dose. So all of the normal structures, all of the critical structure around the tumor, like your heart, your lung, your brain, your optic chiasm, they will get spared. They will not get any radiation at all.
My name is Tracy Clifford, and I started my long journey from California to Beaumont when I decided to go through the proton radiation therapy. My wife and I, after dinner, we came home and I was on the floor with the dog. She went to help me off the floor and I fell on my back. And that's when I thought I broke my tailbone. I went in for an MRI and it turned out that what they thought was a break in the tailbone turned out to be a sacral chordoma. It was a tumor.
In his case, the tumor was involving the upper level of the sacral area. That surgery, a good surgery, would result in a lot of morbidity, loss of function of his organs. We have a technology called pencil beam proton therapy or intensity modulated proton therapy. It is looks like a pencil that you can get a marker that you paint the tumor, pixel by pixel.
The advantage to this technology is it allows us to paint dose point by point throughout the tumor and allows us to maximally spare normal tissue doses. On top of that, we have 3 different types of imaging, which allows us to make sure that the tumor and the patient are in exactly the right spot every day for treatment.
The treatment can be delivered within 5 minutes, or it can go up to 1 hour. The treatment went perfectly. He had some side effects, including some skin toxicity and redness. His most recent imaging scan showed a significant response of his tumor.
So it made me feel pretty good about the decision to come from California, pack everything up, and put my life on hold for 3.5 months and move out here.
The Beaumont Proton Center has made a huge impact for our patients here in Michigan. We've been able to treat in our first year over 100 patients that otherwise would have gotten treatment that potentially wouldn't have had as good dose distributions and so would be potentially at higher risk for side effects.
Proton therapy will be the center of the technology for treatment of cancer patients with radiation as it will result in the better quality of life.